Hi, I'm Devika. I work at Greenstown Family Clinic and I can see some of my colleagues there. Thank you for coming out. I'll only take 5 minutes. I'm hungry also. So, I look after a population of 355 to 360 patients at my clinic with diabetes. How my journey started at Greenstown Family Clinic in Manirewa. I was working at another practice, and through some contexts I've learned they were looking for a nurse. The GPs recognized early on that they don't have the time to look after the patients with long-term condition because they need time. So I got the opportunity to start with them. The expectations, very open to innovation, let me implement, review, lead changes, and we felt necessary to, as they felt it was necessary to establish a nurse-led clinic back in 2009. What we did, I was new, this was a very new concept, warm handover from the GPs. It was very new to me also. By the way, I'm a Fiji graduate nurse. I didn't have any extra knowledge. My mom has diabetes and stage renal failure, so that got me here to try and learn more about diabetes. So this was all very new to me. But I had very supportive colleagues, and my GPs were my teachers. They took time out to teach me, of course taking responsibility for my own professional development. Some of the things we did was a warm handover from GPs. If they saw a diabetic patient, telling them about my role, introducing them, I'd go into the room, and if they wanted to catch up with me, do it right there and then. My own consult room. And our basic appointments for any chronic care is 30 minutes. It changes when it's insulin initiation or diagnosis, new diagnosis. Insulin initiation is a 1-hour consult. And then after initiation, we try and follow 2 further face-to-face consults, which is 30 minutes. It's too hard to try and expect your patient to learn everything in one consult. And along the way, we have carried out many PDSA cycles. They enable us to do nurse-led clinic, accountability and responsibility, which was very clear, expectations. All GPs must discuss care with the nurse lead before changing management. Just-in-time clinic education, opportunistic teachings with GPs, open door policy so that I can always go to a GP to discuss patient management and medications with every consult. Dedicated time to specific long-term condition management. We do many other nurse-led clinics, so very horizontal team approach. I can tell my doctors off if they change my patient's medication without checking with me or discussing with me, or they get a red alert. And we do try, the Greenstown does have a vision where we follow standardized care, so through regular peer reviews and things, that's the opportunity which we use, which is every fortnight, 1-hour session, which involves nurses, doctors, healthcare assistants, and if receptionists want to join. And we discuss there and we agree to provide the same standardized way of care to our patients. Time management, initial consult, maintenance consult, insulin, as I've said, recalls. The initial barriers, and we have literature, getting initial buy-in from all the team members, including nurses and admin. This was a new concept, and that we were all unfamiliar with. This was 2009. Changing patient behavior, that a nurse can provide care, better care. New concept for patients. Short-staffed, so initially difficult to find time to initiate clinic. As a result, we have employed more nurses and nurse practitioners. How are we doing now? We have 355 diabetic patients. I have 5 patients with a HbA1c of over 100, 30 patients with a HbA1c of over 75, 90% of my patients are up to date, of our patients are up to date with food check, 89% up to date with photo screening, delay in ophthalmology appointment. The great thing with Counties Manukau that's happening now, we do get acknowledgement letters to say they're running behind. We have 80 patients on insulin. 2 patients stopped insulin last year, which was interesting. Minimal referral to specialists. I do liaise a lot with the secondary care specialist. I'd like to thank John Griffiths, who happily takes my phone call and will start teaching me. He can stay on the phone for 30 minutes. And the diabetes nurse specialists. Insulin initiation is carried out in the nursing clinic. We decide with the patient. Yes, there is lots of discussion about which insulin and what's the right insulin, what's the wrong insulin. I strongly feel if you put the patient at the center, there is no right, no wrong insulin. If you provide that holistic care, patient insulin, like I said, initial consult, then 2 follow-up consult, then from there on we discuss with patients in partnership how they want. Some patients, the elderly, Pacific Island Indian patients, they do want to come in for a few more consults, which we do facilitate. And so the cost around those things, and I'll leave that to all of you. We all know how expensive that is. Key factors for success, it is essential to have a timely recall system. I spend 1 hour every day doing active recall and case review on my 355 patients. The recalls on all diabetic patients, basically I have created, it's set 3 weeks in advance to their medications due. This is to try and simplify things for your patients so that I can send the recalls out in time to get their blood test done in it before they come in for the clinic, so you can do a whole wrap-up consult in one consult, rather than they come in, then you give the blood test form and the cycle just continues. For new diagnosis, like I stated, we do have 60 minutes consult. We have standardized structure that everyone should follow. We'll explain, I'll just show you a model of care. And the biggest thing is teamwork. And we are colleagues who work together, sharing knowledge, talents, and skills to achieve common goals. This is a Diwali celebration at my place. So these are some of the screening or tools we have created in the last 9 years to help us provide comprehensive care. So every time I see the patient, I use this bit here to every 3 months to do the consult. It's a .diab keyword on MedTech, and this is how we do. We do PHQ2 screening, and sometimes the consult ends up from 30 minutes to 90 minutes, which is okay. So that's why when my time is protected, I can't spend that much time with them, and it works. And that's it. Thank you.